Welcome to the Simply Pediatrics Podcast, simplifying holistic healthcare for infants and children. We're so glad you're here. Join Jennie Zethner, holistic pediatric nurse practitioner and holistic mom of 3 on a mission. Listen in as she shares the answers to the most asked questions from parents in her practice every day and offers parents practical strategies and actionable steps to support their child's health and well-being. Enjoy this insightful episode of the Simply Pediatrics Podcast and stay tuned for more information at the end of the podcast.
Hi, I'm Jennie Zethner. That's right, I'm here in my car. I don't know about the rest of you, but I find sitting in my car to be very peaceful. It happens to be one of the quietest places I have in my life. I have 3 children. I work full time. I'm busy like the rest of you, and I really would like to share information, and doing it from my car is most convenient. So I'm going to ask you to please forgive if there's any commotion behind me, any beeping, any dogs barking, ambulances, fire trucks, etc. I'll do the best I can to find quiet places. I assure you I will never be driving my vehicle when I speak to you. I will always be pulled over and parked. I am typically parked waiting for one of my children to come out of an event or something. So that is what I'm doing with my time here. And I look forward to sharing information with you. And again, forgive me for being a little unprofessional being here in my car, but I hope it works. And with that, let's get started.
Today's episode, Ear Infections, Part 1.
Hello and welcome. I'm so happy to be here with you today. I'm talking about a topic that makes me get a little bit angry. So you might hear me like a little angry talking about this topic today. All right, I try to keep these, podcasts short, and this is a topic that is huge. So I'm going to put at the end of the podcast links to studies and information for families, because what we're talking about today is ear infections, specifically inner ear infections. This podcast will not talk about swimmer's ear. If you want some information about that, we'll talk about it another time. 2 completely separate things. Just really briefly, swimmer's ear infection affects the outer ear, meaning like you go swimming in a lake or a pool and some water gets inside your ear there, the area that you might use a Q-tip in. Well, you shouldn't, but you should be very careful. But the part that you can see, okay? Water gets in there and causes an ear infection that's considered swimmer's ear or outer ear infection. We are not talking about those. We are talking about an inner ear infection. And quite honestly, I don't even like the word infection. I'm using it so that everybody knows what I'm talking about. But really, what an ear infection is an inflammation. So let's break it down. Try and do this quick because there's a lot of information to cover. So there's a tube right here, okay, inside, that is called the eustachian tube, and that is on the other side of the eardrum, right? So your ear has a canal, we have the eardrum, and the other side there's another canal. That's called the eustachian tube. The eustachian tube connects the nose, the mouth, and the ears together. So, for example, all of you out there, if you've ever flown on a plane, rode on big hills, and you felt that popping in your ears, that was your eustachian tube kind of adjusting. If you've ever had a head cold and you felt kind of like clicking noises in your head, that's the eustachian tube. If you've ever had a child who's had a perforated eardrum, that is the eustachian tube filled up with mucus and fluid, and the tiny little tympanic membrane there ruptures. So there's a real full range of what we medical providers call ear infection or an ear inflammation. The body's using mucus to get inflammation out of our bodies. It can accumulate from the nose and into the ears. In our little ones under the age of 3, the eustachian tube is positioned in such a way that it actually encourages the fluid to kind of sit back there, which is why children under the age of 3 are at higher risk for this type of inflammation. So the mucus gets back there into this tube, and it can be a little bit of fluid or a lot of fluid. And this is where I start to get angry about ear, quote unquote, infections. They are seriously overdiagnosed. Across the board, hands down, one of the most overdiagnosed illnesses that children receive, right, from their medical provider. Your child has an ear infection. So It is completely subjective to the experience of the medical provider, the tool that the medical provider is using, and that provider's experience and kind of their interpretation of what it is they're seeing. When we, medical providers, look inside of the ears, we see a whole range of things. We can see something that's considered sort of like dull, like the light in there is kind of dull, so it kind of tells that there's some fluid back there. Or we can see redness, which indicates, all right, there's some fluid and it's causing some irritation. And then we can see even bulging of this tympanic membrane, and that means, okay, we have a lot of fluid building up back there, and that tympanic membrane is at risk for rupturing, which is super, super common. All of these are just signs that we have inflammation fluid back there. It does not mean that there's an infection every time. And infection always comes along with fever. So we can have fluid in the ear without an infection. So if your doctor tells you that your child has an ear infection, but there isn't any fever, you really want to question that provider, all right? Because fluid back there could just be resting and not causing that child really any pain. It's a problem. Don't get me wrong, this is an issue, but it's not something that needs to be treated with antibiotics. And that's really where I start to get angry. And that is the base of this whole podcast, is to encourage families to ask more and more questions when their child is diagnosed with an ear infection and they're prescribed antibiotics. Because I cannot believe how many families I see that their child under the age of 2 especially has been on so many rounds of antibiotics, and the parents are frustrated because it doesn't even help them, and then they end up with another ear infection again, all right? So pediatricians and other pediatric providers are taught that when they see an ear infection, it is almost always viral. And what does that mean? If something's viral, it's not going to respond to antibiotics. Unfortunately, many pediatric providers are continuing to give antibiotics for children when they have an ear infection. And so there's so many layers to this that just to begin with, even if there is a true infection going on, and remember, moms and dads, infection is redness, tenderness, and a fever. So if we're having pain in our ear and the provider tells you that we see fluid back there and there's a fever, then we can consider that there may be an infection, but probably it's viral. And we don't need to treat it with antibiotics. So please ask your provider who's telling you that your child has an ear infection, exactly what does it look like in there? Does it look like there's redness and inflammation? Because if your child's not complaining of pain, then chances are there's no redness and inflammation in there. We could just be wandering around with fluid, which is a completely different kind of situation than an ear infection. It's called otitis effusion, which is fluid that's back there that child's probably wandering around with fluid all the time, which is a problem in and of itself that we need to get to the base of. And again, that does not require antibiotics. Conventionally, they treat that with a whole range of things, from antibiotics to decongestants to tubes in the ears. And holistically, we say, well, why are we wandering around with fluid in our ears all the time? And let's figure out why. And that is often a food sensitivity or something in the environment that's causing inflammation for that child. And we want to get to the base of that. And there's a lot more to unpack there that we can get to in another podcast. Really, the base of this podcast is just for families to please, please, please ask their provider if there's other options for their child if they're given an antibiotic for an ear infection. So the questions to ask are, is it just fluid? Is there redness? If your child doesn't have a fever, definitely ask more questions. If your child has pain and the provider tells you there's redness and inflammation in the ear and there's a fever, ask, what else can we do? Can we wait? Can we wait on that antibiotic? Can we hold off? Can we see if the child will heal on their own? Can we try some other modalities? There are many, many, many herbal ear drops that we can give that help children heal heal beautifully. There's many supplements, including vitamins and herbs that we can take orally that help a child get better. And my most favorite modality that I go to when children have fluid in their ears, whether we have fluid effusion, just kind of wandering around, no pain, no fever, and they have just fluid, or they're sick with a fever and pain and there's fluid in there, is chiropractic care, and particularly cranial sacral therapy. So if you don't know what this is, parents, Google it, find somebody near you. It is absolutely my go-to for my own family, for myself, and for all of my patients, for many, many different conditions, but especially when we have fluid in the ears and ear pain. It is almost immediate after you're adjusted. When you have when you go to a good chiropractor that does cranial sacral work, your child will come out immediately feeling better from that adjustment. We will attach to the bottom of this other links to information about how you can attempt, give your child supplements to help them heal. Of course, your child's ear should be looked at by a professional. Please, parents, don't try to look in your child's ear yourself. This is really a very skilled, this is a skill that providers, and the more you do it, the better you get at it. That's it. I mean, this is definitely one of those expertise. You need an expert to, look in your child's ears. When I have families tell me that they kind of looked in there with a flashlight or they brought their own otoscope, I try not to be rude and I say, I can't even go by another medical provider looking into your child's ears. That is completely subjective to the experience of the provider and the tool that provider is using. All right, so that was a lot of information in a short period of time. I really just felt the need today. I've just seen too many families with children who are getting antibiotics over and over and over again. And it continues to be very surprising to me because this isn't really even like a holistic view. This is like, I'm not necessarily one to follow everything the American Academy of Pediatrics says, but even the American Academy of Pediatrics tells medical providers do not treat every ear infection that you see with antibiotics, because most of the time these are viral. And remember, moms and dads, if something is a virus, it's not going to respond to an antibiotic. So the take-home message here is ask more questions. Get another opinion. I just spoke to a mom today who was telling me their child kept getting ear infections, and one day, when she was just fed up with it, that same day that she was told her child had an ear infection, she went to another doctor. She's like, I wonder what somebody else would say. On the same day she went, and a different doctor was like, no, there's nothing going on in there. Proves my point completely. I mean, it really is, have a trusted medical provider, understand what the symptoms are, and ask lots of questions. All right, that is it for me today. And remember that parenting is a journey and you're doing an amazing job. Stay curious and keep learning, and I'll see you next time.
Thank you for joining Jennie on the Simply Pediatrics Podcast. We hope that the valuable information she shared in this episode will inspire and empower you on your holistic parenting journey. If you would like to learn more about Jennie, her Simply Pediatrics practice, or anything that she spoke about today, please check the show notes that accompany this podcast, and you'll find all the links and resources you need. You can also sign up for the Simply Pediatrics mailing list so that you receive Jennie's weekly newsletters packed with vital information and holistic parenting gems. If you've enjoyed today's episode, please consider giving this page a like and subscribe to the channel so you don't miss any episodes. And don't forget to connect with us by sharing your thoughts in the comments section below. Follow Simply Pediatrics on any and all of the social media platforms. And if you're interested in an in-person or virtual appointment with Jennie, please see the contact details in the show notes. Stay tuned for more episodes packed with a wealth of powerful information to support you on your holistic parenting path. See you next time.